result for AMC MCQ-CAT. And just like Coffee with Karan, we are here with our own Coffee with Dr. Akram and Academically to just have a casual chit-chat session. So before I start the session, I would like to welcome our CEO and our guide, Dr. Akram. Dr. Akram, please.
Thank you so much, Dr. Snida. So, academically, I started because, when I was in Australia, so I found a lot of medicos, they are struggling to get into the practice. They are doing a lot of odd jobs. All healthcare professionals, when they are doing in MBBS from India. So most of the consultancies in India, they are saying, please go to do your MPH, Master of Public Health, or go for MBA, in Australia, and they have to invest 40-50 lakh rupees. After that, still they are struggling to find a suitable job in Australia, right? So I thought, make a platform for the global healthcare professionals to want to work in Australia, so we can help them end-to-end process, like their documentation process, AMC journey, and after that AMC job and placement assistance and all those things. So we are working. I really feel very good. When a student says that, "Sir, I passed the exam," and so last Sunday, what happened? There is one my ex-student. He passed the exam, and I think in 2015 or something. Last year. So he called me last Sunday. He was calling me basically many times, so I'm a little busy. So I called back him on the Sunday. His name is Pratham. He's from basically Haryana, and he got a placement in government hospital in Melbourne. So he was asking my advice, sir, मैं अभी क्या करूँ? क्या मैं इसको continue करूँ या मैं इसको छोड़ दूँ? So I thought, yes, you can go join definitely. So generally होता क्या है in Australia, salary in government sector little bit low as compared to private. Like in India है, हमारे यहाँ उल्टा है कि गवर्नमेंट में सैलरी ज्यादा होती है, प्राइवेट में सैलरी जो है थोड़ा सा कम होती है या इक्वल होती है, राइट? तो we are still in touch with those students हमारे पास करते हैं, and really I feel very very good कि स्टूडेंट की सक्सेस स्टोरी तभी होती है once they pass the exam and they got a job and they land in Australia, right? So we are here to help you all. Thank you so much. I'm happy to answer all of your questions, whatever you have regarding jobs and visa and other things as well, after this conversation.
Yeah. Thank you so much, Dr. Akram, for that insight. And we all know the struggles of a doctor, right? We all have been there through those night calls and then still having to come for the morning round and giving that morning handover with a cup of tea or coffee, whichever we like, right? I can see everyone smiling, understanding. After that whole night of emergency, okay, still handover there. We still have the samples left, which we have to send to the lab before we head home at 10 a.m. even after 12 hours of shift. Okay, so AMC is not an easy exam to crack, especially when we are coming from Asia, where there's more concentration on the theory. And I bet you agree. So maybe we can start with Dr. Shravani. Dr. Shravani, can you tell me how adapting from the Indian system, where it's more about cramming in theory and learning those outlier questions, whereas in AMC, you are in that pattern, but you're concentrating on the repeated concept and applying your medical knowledge. How was your experience with AMC?
I gave my NEET PG exam in 2019, ma'am. I still remember, there was a lot of stuff which I had to memorize, like biochemistry, all the cycles and everything, and many, especially community medicine, we had, maybe it is important, maybe, but it was a lot of a rote memorization. The exam is based upon a kid will score who has the more ability to retain information rather than apply it clinically. So I think AMC and even in fact even USMLE, they change in every question is like a patient. Like if a patient comes to you with this, what will you do? The patient doesn't wake you up and ask what is the next step or like what and who invented this. Those things are not tested in AMC. So I felt it was more of a clinical exam rather than a rote memorization exam.
Yes. So, Dr. Shravani, you have experience. You have finished your anesthesiology. Did you find the change in SOPs quite troublesome while you were preparing for the exam? Because the SOPs in India and Australia, what we generally hear, are quite different.
Yes, ma'am. Especially ops and gynae, the things which we learned were quite different from the things which people apply in Australia. It was a kind of difficult for me to, like, here we don't take a chance. If it's MSL, we'll directly take to C-section. We
Yes.
don't wait, because maybe it's because of lack of infrastructure, or maybe many reasons play a factor in India. So if this MSL will directly ship, there's no wait and watches, there's no fetal scalp blood monitoring or anything. And there are many places where there's no CTG also. Because I personally worked for 1 year in my senior residency, there was no CTG. So it was more of like, we didn't have those many protocols as such when I was learning for this exam. Okay, there's a whole, like, what do you do next and everything. So it's a little bit different. Maybe all the, like, normal labor, wherever you go, it's same. But what to do when this problem arises, it's quite different from India and then to Australia. Even for massive blood transfusion, we entirely have a different protocol. And even the protocol changes from hospital to hospital. But there you have like set guidelines and everything. I really like the cervical cancer guidelines of Australia. I was very like amazed to see, like, there was a whole flow chart, what to do, every cancer screening. Here, there's no thing as cancer screening. Maybe you'll only see while preparing for some exam, but in reality, it's quite different. We are not taught all the cancers. Even I myself, I didn't take any HPV vaccine until I think I was around 26 or 27. Even though and I finished my entire UG and everything, but we didn't know, there was no such importance. So I
Oh,
felt this exam was quite different in all the protocols which you follow there and here. And coming to ethics is an entirely different thing. I wish they taught ethics to us, because nowadays, see, even any emergency medicine physician, OBGYN or anesthetist, we quite frequently face agitated patients.
yeah,
Even
true.
we are not trained as such on how to handle the patients. We will be post some 24, 36 hour shift. The patient will be angry. Like, we are not taught how to deal with them, what to do, what is the next step, how to approach a patient, how to, like, break the bad news for the family. I think ethics here in Australia, I felt when I was reading the whole book and everything, I felt you at least have a guideline. I don't know whether they'll follow or not. At least there's some awareness on, like, this might can be done, this needs to be done. We didn't have all that. So I felt that's how, like, different it's from here to there.
Okay, thank you, Dr. Shravani, for that insight. So now that we were talking about the periphery and the SOPs, we have Dr. Vijla here, who's currently in her bond 2 years. She's about to finish that. So, Dr. Vijla, how did you feel like being posted in periphery with limited resources? So, being an anesthetist, Dr. Shravani has access to, I think, all the advanced technologies that we can talk of. But now you are working in a periphery, and I have worked, trust me, I was posted in a village emergency where even if a snake bite you, first to realize if it's a snake bite, you have to use all the you don't have INR PTT. You can't give that. There's no lab doing it at night. You just have to just take out the sample, put it in an empty vial and wait for it. If it's clotting in and you hold the watch with you. So what are your like, what do you think? How, while working in periphery, which has a very different kind of SOP, and then while you were preparing for AMC, how is that, like, how was that clashing in your mind with that all that knowledge?
Yeah, yes, I am working in a periphery, but this is a mission hospital, so it's mainly for the leprosy people. So,
Oh,
yeah, we do have IV patients, yes. So, yeah, as Dr. Shravani said, like in India, even for the ALS and all, like when there is a emergency, like it's entirely different. In the emergency part is entirely different for Indian protocols and Australian. So in India, um, even like we have hierarchies and all also. So we'll be consulting one of the physician consultant or something, and then waiting for their reply, and then till the moment they have to give us a, I mean, until and unless we have got a reply for them, we can't do anything. And then if we have done something also, then the next day they'll be like, why did you do that without us? Uh, so yeah, so it's so, but it was actually, it helped me a lot. The preparing for AMC actually was like actually it was really helpful, like protocols and like clinically, it improved my knowledge a lot. It actually helped me to understand like all the, not just the protocols and guidelines. It's like how to treat a patient more elaborately, how to look just I mean, in India we see the patient as a case, but more than just a case. I mean, we can just go through the entire things about the patient.
The
Yeah.
empathy and respect that's
Yes.
missing, right? AMC
Yes.
is teaching you via their red book.
You know, so that just helped me a lot actually. Like after a point I started practicing just like how they said, so that I can just embark and do whatever they are telling. So in the beginning and all, as she said, like after a point we'll be doing one whole day on call, 1 week I'll be on call, so that one whole week on call thing. And then the OPD per day I have some 100, 120 patients I alone have to see. So 5 doctors will be seeing some 600 patients and all. So the OPD patients will be making a huge noise and big halla and also. Uh, then I'll be at. There used to be a point when I used to lose it, but then after a point I understood. Okay, we should start being a bit. You should start being a bit empathetic to them, and then. AMC helped me a lot. Like in that way, by improving my clinical practice, yes, preparing for AMC was a really good help for me in that
Okay.
ways.
So now we move on to Dr. Govardhan, who's coming from a typical government setup. So where
Hi.
you go to a labor room, let's because gynae is like the most talked about stream, right? Especially after internship. I came out of internship, and personally, I also did from Government Medical College 32 Chandigarh. After that, I was like, I know one thing: gynae is one subject I don't want to do. Too much of chikna chillana ladai.
uh, yeah, exactly, doctor. Like you have mentioned, a labor room in a government hospital is like a market kind of place. Like you have Chikna Chilana, as you said. There's a lot of uh, it's kind of trauma room
Market.
rather than a labor room. So yeah. So and just now, Dr. Vijay has also told like uh, seeing all the practice that has been going on here. Especially, I've done my internship in government medical college. It was like a lot of patients with no proper organization, I guess,
Mm.
because you'll have to see so many emergency cases, you'll have to see so many OPDs, OPD IPs, which was not very well organized. So I think that's what made me choose a different path rather than NEET PG. I wanted to explore things like maybe I wanted to learn medicine in a very organized manner. So that was my
Mm.
intention. And looking at all those OPD trauma things in emergency casualty was like not my cup of tea in internship. It was hectic.
It is hectic. But how much I just talked about Red Book. So, Dr. Govardhan, how much was Red Book helpful to you?
It was very helpful for me. Like uh, it opened up a new aspect of medicine for me because you'll have to know all the ethics part, you'll have to know all the guidelines part, how you're gonna do, like starting from first step till the last step, you'll have to go in a stepwise procedure. So it
Hmm.
was like a guidance for me. Like it opened up a new aspect for me to look at cases or maybe rather the patients.
Oh, okay. So, Dr. Vijala, if you could come online, we are going to play a quick game. Okay. And Dr. Sonal, you please also be a part of this game. Okay. I'll quickly give you questions and two options. And you have to choose one or two. Okay. So, on call choice of drink, tea or coffee?
Tea.
Coffee.
Neither, if there is an option of neither.
How do
Yeah,
you
there
survive?
should be an option of neither, ma'am.
How do you
Yeah.
guys survive on calls? What happens at 2 a.m.?
Hydrate yourself, maybe.
Okay, okay,
Yes.
okay, but that was just a joke. So we'll move on. Well, in preparation, you prefer handwritten notes or you prefer highlighting on an iPad and the soft copies? All of you,
Uh,
Dr. Vijay as well, please. Handwritten notes or soft copies?
I personally prefer soft copy, ma'am. I hate my handwriting. I myself can't read it later. So if there's a soft copy, if I find something new, I used to just mark it. That's my habit of reading. I don't like my writing because the amount of PACs and every case it's a write, I just don't want to see my handwriting. So I prefer soft copy.
Dr. Vijala?
We don't have a option. We only have to prefer the soft copy. We don't have any option for handwritten. So it's only soft copy.
Okay. Dr. Govardhan?
For me, it's always handwritten notes, doctor. Like I have to write it down for me to study it because I cannot do it from on screen because yeah, I cannot just do it. You'll not believe, even like 2 days prior to my exam, I was writing notes. I was writing notes for my vaccination schedules. I was writing notes for the exclusion criteria of children and all those things because I have to pen it down for me to study. So
Yes.
in that way, I think I'm an old school guy.
And when I
Okay.
think when you write something, it gets inside your head also, like
Yeah.
without
Yeah.
writing.
Yeah. Like
Unless you
writing
don't like your
something.
handwriting.
Yeah.
Hmm.
Writing something to recall, I do that. Like while active recall, I do write. But reading and like my main notes has to be very neat and everything. With like first time when I've written AMC, I think there was some like 3 to 4 books of like my only scribbling of handwriting. But my actual notes were like probably in my iPad, everything would be neat, but not making right while like listening to class and writing it. I cannot do that.
Okay. Okay. So, when do you study? Early morning or late nights?
For me, it's late nights. It's
Okay.
definitely late.
And you don't
I
take
am
the
an early morning person, but I don't know why. But since I started preparation, I don't know. It's because of the stress or something. I can sit anytime. I
Yeah.
used to sit anytime. I used to wake up early morning also.
I will.
Sometimes you would have got up from your sleep also and you would have started studying like,
Yeah.
oh my god,
Yes.
I'm
You just
missing this
bite
one.
out of sleep. You just start. You, oh my goodness, it's late. You just
Yeah,
start
it
studying.
happens. It even happens at work, right? So when sometimes, I am into something and then I suddenly like next day I'm calling Dr. Snigdha and telling that, ma'am, I got this in my dreams also. Then she's like, chill, you don't have to worry so much. We will
I'll
figure
tell
it
you,
out.
but I'll tell you a real-time story, but after Dr. Shravani tells me if it's early morning or late night.
It used to be early morning, ma'am, but now because of my hospital timings, I had to read it in the evening.
Okay. So I'll tell you for me what Dr. Sonal was saying. I finished my MD exams. And I was like, oh shit, I've already qualified my MD and now I'm working. I don't have any exam. So yes, I do understand that kind of stress, especially with the exam. But yes, this was a very nice light chit chat, right? So
Yes, ma'am. Correct, correct. And it really, it brings you back to your college days and the kind of struggle people have. And, it's really, really like people say that doctor word, if you're putting it as a prefix in your name, it's something which is very fancy. But what efforts has been put up for that fancy prefix is something nobody will understand. For the females, we lose our glow, we lose our hair, we lose everything, and we don't even know how to get ready. So you won't even believe, guys. Sometimes I really call Dr. Singh just to ask, ma'am, how should I get ready? What gift should I give to this person? Because see, these are my, even if she's my manager, these are my silliest questions to her. Because you actually sort of have detached yourself from the society. You don't even know how to respond and do that. You just know how to do your work. So this is the thing. This has actually transformed ourselves from being a normal person to, being a medico.
the sacrifices that
The sacrifices,
there can
yes.
be a long gala of sacrifices that we all doctors can write one day. But
Yeah.
hoping now that this AMC journey that you have just begun will give you an amazing life and future ahead. So with that, I think today we can end this live. And thank you so much for joining Dr. Shravani, Dr. Vijala, and Dr. Govardhan. Congratulations once again from Team Academically. And we hope to see you for the future sessions for your CV writing and job assistance.
Thank you,
Thank you,
ma'am.
doctor. Thank you.
Thank you,
Thank
ma'am.
you. Thank you, ma'am.
you. Thank you, everyone else, for joining this live. See you next month.
Thank you.